per 100,000 population. And when we look at our caseload, in terms of local and imported transmission, we've emphasized over and over that we've already established community transmission, particularly in the high-burden counties, and that in terms of disaggregation by male or female, the male population continues to be the one that is greatly afflicted. To date, in terms of cumulative count, we have about 20,236 males affected and about 11,205 females. Now, reflecting on age disaggregation, we'd note that to date, in terms of the 30 to 39 age group, they have accounted for 33% of the cases, with a count of about 10,283. And we continue to take this as a wake-up call for young people, reminding them that the disease is real and it is claiming lives. And when we look at our case fatality rate, it stands at 1.6%, with a total count of 516 cases confirmed. This rate, of course, one death is not acceptable, but continues to be below the national average. And in terms of looking at fatalities, much like our confirmed cases, our male population, again, continues to be greatly afflicted when it comes to fatality, with about 386 of them being male. Yesterday, we looked at our positivity rate, and I remind you that that stands at 7.9%. And we were able to look and see, in terms of trying to explain to you how the curve will continue progressing in terms of this positivity rate and the goals that we have of lowering this to 5%. When we look at the symptomology, again, taking stock of the week that has passed, the picture remains the same, in that 7% of our cases are symptomatic. 51% of these cases, in terms of symptoms, continue to be the symptoms that we've discussed. Cough is the leading presenting symptom. Fever, 37% of our patients have fever, whereas 27% of them have difficulty in breathing. And in terms of asymptomatic cases, our cases stand at 93%. And this perhaps is a double-edged sword, because it means cumulatively only 93% of our cases are symptomatic, and that's a good thing. However, if we look at it on the flip side, it means that 93% of our cases can be potential transmitters of this disease, seeing as they don't demonstrate any symptoms. Now, in terms of recovery, we continue to record recoveries. Again, we celebrate our home-based care program, noting that we've had a set number of recoveries from it, and we continue to implement this program in terms of it reducing the burden on our healthcare facilities. When we narrow down to our healthcare workers, we note to date about 885 of them have been infected, with 16 deaths reported across the 35 counties. And in terms of critical care, to date, we have 31 patients who are currently in ICU units across various health facilities in the country. And while we've recorded some significant gains, we do note that in order to be able to fight this pandemic, we need to fight issues such as stigmatization of patients, and we do continue to receive disturbing reports about how several families and even individuals have been stigmatized by their fellow Kenyans. And we continue to appeal to people not to stigmatize, because it is important that we all adopt a brother's keeper approach in trying to stamp down this pandemic. Finally, we should remember, again, we have 3 remedies against coronavirus in terms of being able to contain this virus. We remind everyone that you need to wash your hands with soap and water. You need to wear your face masks at all times in public places. You need to maintain social and physical distancing, and we need to avoid forms of public gathering. Reviewing the week that has just passed, in terms of our COVID statistics, we ran a sample size of 4,470 in the last 24 hours, of which 322 people tested positive, bringing the total number of positive cases in the country to 31,763. And from all these cases, all were Kenyan except 9 who were foreigners. And in terms of disaggregation by sex, we had 179 male and 143 female. The youngest is a 3-year-old baby, whereas the oldest is 92 years. And in terms of disaggregation by county, Nairobi continues to lead with 106 cases. Kajiado has 53, Machakos has 25, Nakuru has 25, Kiambu 23, Kisii 23, Busia 13, Mombasa 11, Kisumu 5, Bomet 5, Garissa, Homa Bay, and Nandi all have 4 cases, whereas Uasin Gishu has 3 cases. Kitui, Nyandarua, and Taita Taveta and Turkana also all having 3 cases. Nyamira has 2 cases, Kericho 1, Murang'a 1, Vihiga 1, and Makueni 1. We have provided for you the disaggregation of each county by sub-county in terms of the caseload. In terms of our recoveries, we have 288 patients who've recovered from the disease, of which 190 are from the home-based care program, whereas 98 have been discharged from various hospitals. Our total recoveries stand at 18,157, and we do really sincerely appreciate our healthcare workers for the good job that they're doing. Unfortunately, today we've lost 16 patients who succumbed to the disease, bringing our fatality to 532, and we would like to pass our sincere condolences to the families and friends of all of those who've lost their loved ones. Thank you, and we now welcome a Q&A session.
Any questions? No questions? Yes.
Okay, thank you, Waziri. I'm Haimba from Ebro TV. Maybe following the statistics that you have actually released today of the positive cases, the new positive cases, do you feel maybe as we enter the month of September, there is hope that these cases will have to go down further?
My name is Dorcas Wangera from Citizen TV. Yesterday you gave us the trend in the curve, but there was an observation that there's a bend in the curve. What does that bend mean and what does it tell us? And then also, what is the epidemiological term lifting the line in terms of health capacity workers? And where are we with lifting the line other than just flattening the curve?
Good afternoon. I'm Purity from KBC. My question is in regard to the health workers' strike. There is a notice already, and in Nairobi County, if I'm not wrong, they're supposed to begin their strike today. Are there any talks that are ongoing in this regard? Again, on the protection of healthcare workers, I know there is a lot of conversation going on, especially with the supply of the PPEs. On the counties, again, there are counties that have been highlighted not to have already met the 300 isolation bed capacity, and we have our graph still not at the peak, as you say. Update us on the county preparedness. How many counties are yet, if you could list them for us, are yet to achieve the 300 bed capacity?
Zainab Mohammed, TV47. Following up on Purity's question, we've done a spot check with different hospitals where patients are being turned away due to the doctor's strike. What is the ministry doing towards solving this?
Thank you Zainab and Purity and Kaimba for your questions. We'll begin with the issue of the doctor's strike. Yes, I think this was Purity who asked, are there discussions underway? Yes, there are discussions underway. As early as last night, we continued to have discussions with members of the union and healthcare workers, impressing upon them that perhaps now is a critical time to be mzalendo and ensure that we are taking care of our country, but also hearing their needs and their concerns that they have and coming to a place where we can be able to meet those needs. These discussions continue. There are a few challenges here and there, but they're being worked out to ensure that we have an amicable resolution to this. Concerning the patients that are being turned away, again, our plea is for the union members to continue engaging in negotiations with the different county governments, with the Ministry of Health, and all the other line ministries who are supporting us to be able to ensure that no patient is turned away. In terms of capacities at the counties, yes, this continues to be an improvement on a day-by-day. As at last week, we had a number of 65% of counties being ready in terms of capacities of bed, in terms of capacities of needing the requisite number of healthcare workers, as well as different inputs like the PPEs. We continue to improve upon this, but also we are getting to the point where we need to actually leverage on whatever facilities are available. I'm sure you've all seen reports where people have said that we have empty isolation units. Yes, that is happening. And so we're getting to the point where perhaps we need to have a regional approach when it comes to managing COVID-19. And this was best exemplified in the Lake region, where they're going to have a regional approach in sharing whatever facilities they may have, so that we can leverage on what we already have on the ground and have rational deployment of resources. When it comes to the issue of September, Kaimba asks, what will it look like as we continue, will the cases continue to increase? I'm happy to note that we have actually a meeting today with our modeling teams to be able to take into review of the current situation. When we look at the past models, at least updated as at 2 weeks ago, they continue to inform us that the curve shall continue going up, with a dipping of the curve coming about around December all the way to January, February, March. So we're still, at the escalation phase of the curve. And yes, in the graph that we shared with you, you did notice a dip. And yesterday we articulated this with the DG that primarily the main issue was the reduced testing that was occasioned by challenges in our labs that had come down but are now soon to be activated. And that's why you saw the dip. But if we were to do a massive sort of, scaled prevalence study, we would note that our cases still continue to rise. And usually when you're looking at an epidemic curve, a day is not really enough for you to be able to determine that shape. You need to see it in terms of a time series, a trend. And so that's what we are getting from our modeling teams, that the curve continues to peak. In terms of our healthcare capacity workers and lifting the line, the idea is when you look at that epidemic curve, you want to be able to prolong it. You want to avoid a big steady peak, because when you get a big steady peak in the curve, it means that there's risks of overwhelming the healthcare system. And so what we're doing as government is to ensure that, one, we have the requisite inputs that we require. Two, which has been fantastic and has gotten good accolades across the world, is the home-based care program. I've seen counties such as Mombasa actually celebrate the home-based care program, which has reduced the strain on their healthcare facilities. And so in essence, we would then be moderating the curve to reduce the height of the curve, to reduce the impact or the caseload in terms of the health sector. With regards to our PPEs, again, I'm happy, and particularly the donations that we continue to receive. I'll ask Mr. Kefa to continue sharing with you information on how we shall ensure that counties have what they require in terms of PPEs, but also in terms of ventilators and other support materials that we have. Perhaps, Mr. Kefa, you can come in at this point and share that information.
Thank you, Waziri. As you are aware, and we have continuously informed you, all the donations that we are getting, we give them out based on the caseload from each county. That means those counties with bigger caseload get more. And we normally look at all the counties plus the national facilities, including other institutions which are at the front line. In terms of the 300 bed capacity that you asked, the ministry is thinking that from the donations that we are getting in trying to support those far-to-reach counties, the counties which are very far from the urban areas that people could get access to ICU facilities, the ministry is looking forward to share some of those donations in the line of ICU materials that are coming to be able to support and enhance what is happening in those counties. Thank you.
Thank you so much.
News.